The orbicularis oculi and levator palpebrae superioris are a group of antagonist muscles that change the size or location of the palpebral fissure. The palpebral fissure is defined as the space among the medial and lateral canthi of the eyelid. In more simpler terms, it is the opening between the eyelids. These muscles work together to allow the canine to open and close its eyelid, or blink. The orbicularis oculi is a flat elliptical muscle that is split into two parts, the pars palpebralis and the pars orbitalis. The pars palpebralis is the eyelid part of this muscle that is found in the upper and lower eyelids. The upper lid of this portion is usually bigger than the lower lid. It contains fibers that run through the substance of the eyelids. These fibers come from the medial palpebral ligament, which goes around the palpebral fissure and ends on the ligament. They are located towards the front of the body in relation to the tarsus and tarsal glands, which are glands that prevent the eyes from drying up. Its main function is to close the eyelid by decreasing the upper lid. The pars orbitalis is the outer part of this muscle that is found around the pars palpebralis. It is located on the skull, and its main function is to tighten the skin around it, which secures the eyeball. It has ventral and dorsal parts that come from the medial palpebral ligament. The fibers of the ventral part spread out toward the back end of the organisms on the surface of the frontalis muscle. The fibers of the dorsal part come into contact with the ventral fibers, which form the lateral palpebral raphe. This muscle starts at the orbital margin and ends at a ligament called the lateral palpebral raphe, which is near the inner portion in the corner of the eye. It goes around the outer corner, and the inner portion attaches to the skull. It shows a sphincter-like action to close the palpebral fissure, which is its main function. When this muscle contracts, it shortens the distance between the upper and the lower lid to the point where the opening looks like a horizontal slit. When a dog squints its eyes, it can mean that she or he is trying to please you or showing you a friendly gesture. If the dog's body is low to the ground, then it can mean that he or she is scared, which means that she might want to bite you. It can also show signs of being anxious. Its antagonist or opposite muscle, the levator palpebrae superioris, is a muscle that draws back the superior eyelid. It is a flat muscle that comes from deep within the orbit or the socket of the eye. It faces the optic canal with its back side and gradually gets wider or thinner as it goes by the eyeball. It ends at the superior tarsal plate, which is at the lower edge of the upper eyelid. The superior tarsal plate is made of connective tissue. To get there, it passes between fibers of the orbicularis oculi. Its fibers consist of smooth and skeletal muscles. Its main function is pulling the upper lid further from its normal position, which allows the canine to have a broader view of its surroundings. When a dog opens its eyes wide by lifting its upper lid, it can show signs of being surprised or being curious. It can also show signs of the dog being happy, playful, and alert. The orbicularis oculi muscle is supplied with the seventh cranial nerve, while the levator palpebrae superioris is supplied with the oculomotor nerve. These nerves overall help the movement of the eye. The functions of both of these muscles together have a varying effect on the dog's facial expressions. as they help the dog express what it feels towards people. It also impacts its survival, as having the ability to see allows the dog to navigate itself through its surroundings and other creatures.
The orbicularis oris is a muscle present in the dog to bring back the mouth to a closed position after it has been opened. This muscle performs the opposite job of a zygomaticus as it extends itself outward, forcing the lips of the dog to close or to go back to the resting position. Both the muscles also contrast as the orbicularis oris uses pushing movements while the zygomaticus uses pulling movements. The orbicularis oris is located around the lip area as well as inside and around the nose. This muscle is made up of fibers called type 2 fibers. These function to aid dogs to conduct twitching movements. When compared to the type 1 fiber, this type 2 fiber is known to have a higher amount of mitochondrial content that is in the fiber. When compared to other animals such as horses, the orbicularis oris muscle is known to be less developed in the dog species. The zygomaticus is an important aspect when involving the facial expressions dogs illustrate. The way dogs proceed with the action of showing their teeth or smiling is due to the job of the muscle called zygomaticus. This muscle conducts this task by stretching itself from the scudiform cartilage plate to near the corner of the mouth. The scudiform cartilage is located close to the ear. The zygomaticus begins at the corner of the upper lip and is then connected to the orbicularis oris fibers that are present under the bottom lips of dogs. In contrast to the orbicularis oris, the zygomaticus is a muscle that only pulls, not pushes. This muscle can also be defined as a skeletal muscle because it connects itself to bones on the dog. The fibers present in this muscle run parallel between the tendons beginning and ending at them. This muscle can be defined as a flexor as it pulls the lips and mouth in an upward and backward motion. By doing this job, the dog's form is shown to look as if it is smiling. This muscle can exert 3 to 4 kilograms of tension per centimeter as a skeletal muscle. There are 3 main proteins that make up skeletal muscles. Myosin 2, actin, and trimyosin are the 3 combinations used. These proteins usually come together to form a combination of usually really thick or thin fibers to help when contractions occur in muscles.
Man's best friend. Look at that little one rolling around. But have you ever stopped to wonder how dogs are capable of moving like they do? Arguably, the forelimb of the dog is the most important part. 2 opposing muscles, the extensor carpi radialis and the flexor carpi radialis, are both located in the forelimb of the dog. Both the extensor carpi radialis and the flexor carpi radialis insert at the metacarpal 2 and 3. These muscles both originate from the humerus, but they originate from different parts. The extensor carpi radialis originates from the lateral condyle crest of the humerus, which is essentially the rounded point of bones. On the other hand, the flexor carpi radialis originates from the medial epicondyle of the humerus. The epicondyle is located above or on the condyle. The extensor carpi radialis and the flexor carpi radialis both have similar functions. The extensor carpal radialis is meant to extend the elbow, while the flexor carpi radialis is meant to flex the elbow. The difference between extending and flexing is as follows. When the elbow is extended, it means that the degrees between the two body parts increases, and when the elbow is flexed, it means the degrees between the body parts decreases. As shown in the diagram, the extensor carpi radialis and the flexor carpi radialis are essentially the same shape. The main difference between the two muscles is a product of the difference in position. As shown, the flexor carpal radialis terminates at the anterior base of metacarpal 2 and 3, meaning the front of the base, while the extensor carpal radialis terminates at the posterior base of metacarpal 2 and 3, meaning the back of the base. In conclusion, the extensor carpal radialis and the flexor carpi radialis are muscles essential to the movement of the forelimbs of dogs. Without these two muscles, the amazing creatures that we know and love would not be the same.